Welcome back. The Gauteng Health Department is warning of an increase in antibiotic resistance among residents. Officials say this is due to people taking the medicine unnecessarily, making it harder, for example, to treat TB, pneumonia, and even some STDs. Wits University School of Public Health's Duane Blaauw joins us tonight to talk about this warning. A very good evening to you, Duane. Good to have your time. So how concerning is it that a health department is even having to warn against the use of antibiotics incorrectly or the abuse thereof?
Well, it's an announcement that's in keeping with the World Antimicrobial Resistance Week, which is a WHO initiative happening this week. The problem of antimicrobial resistance is not new or acute. I mean, it's a long-standing problem that's been around for a decade, but it is becoming a significant crisis because we need antibiotics to treat a number of important infections, and if antibiotics are misused, then they no longer function when we need to use them, and that can have significant consequences for health and for patients.
Is it due to a lack of knowledge, or people doing what a lot of us have been guilty of, where you feel better and you simply stop, for example?
Well, I think in fact, the theme of this WHO week is about the cross-sectoral collaboration. And I think the Gauteng Department announcement is a little bit one-sided. In fact, it is a much more of a multi-sectoral problem. So the news briefing from the department sort of says it's patients and patients are not using antibiotics correctly. That is definitely part of the problem. And it is about people wanting to use antibiotics when they don't need them, so unnecessarily or inappropriate use of antibiotics, or incorrect use, so people not completing treatments because, as you say, people feel better and then they don't complete the whole course of antibiotics, but what that happens is that can produce some resistance. But in talking about the multi-sectoral problem, I think most of my research focuses on the other side of the coin, which is that in South Africa, it's not that easy to get antibiotics. You have to get them from a doctor or a government clinic. So that, providers are also part of the problem because they are the prescribing antibiotics unnecessarily. So yes, patients are to blame, but also providers are using antibiotics inappropriately, and that's mostly what my work is focused on.
So put simply, doctors are over-subscribing antibiotics, right?
Overprescribing, yes. I mean, so we did a study, for example, a few years ago now, where we trained field workers to act like a completely normal person without any significant problems, acting like they had a mild viral infection. And we sent them as patients, mystery patients, to a whole lot of public and private providers in one of the metros. And over 2/3 of the patients of these completely healthy people in the private sector got given antibiotics unnecessarily, and 80% in the public sector. So, the Department of Health also needs to look at better training and knowledge and information for people working within the department about unnecessary antibiotic use. Because that's also definitely part of the problem. Another sector that's also part of the issue is the misuse of antibiotics in the sort of veterinary sector, because there it's much easier to get access, and sort of rampant use of antibiotics in food rearing and things like that is also contributing to this sort of global problem of antimicrobial resistance and bacteria.
But why would medical professionals overprescribe antibiotics? Is it because it's the only line of defense they've come to know or to resort to? Is it laziness, perhaps, to pursue other options?
I mean, as you mentioned, I think there is a knowledge issue. So antibiotics work for bacteria, but they are pretty ineffective against viruses. So on the side of patients get a cold and they feel sick, and then they feel like, well, and sometimes happened in the past where somebody told them, you need antibiotics and you get better. But in fact, the antibiotics are not necessary because in fact, they do nothing for a viral infection. And doctors generally do know that that's the case. Most doctors are aware that you don't need antibiotics for treating viral infections like a cough or a cold or flu. But they feel like the patients are wanting antibiotics, or they think that people might get better a little bit quicker, or they might feel like they're giving patients what they want in a sense, and so therefore it's just easier to comply. I mean, what we found also in our studies that for example, in lots of places, particularly in government clinics, the providers aren't even examining the patient, so they just sort of hear a symptom and then they give a sort of package of medicines, and that package of medicines happens to include antibiotics. So yeah, I mean, there are a number of factors explaining why people who know what they're supposed to be doing are sort of doing things that are not against what their training might have been.
Also worth explaining, of course, is what the actual danger is of being at a point where you are resistant to the everyday or prescribed antibiotics that many of us would be given commonly. What does that mean for you physically? And if you get to that point, where does it leave you in terms of medical options in the event that you actually now at a point where you require the said treatment?
Yeah, so I think, I think that's part of the difficulty is that, a person misusing antibiotics or using them inappropriately doesn't feel that urgent threat, because to some extent you're sort of displacing it to some other people or some other place or some future time. So you don't actually get the negative consequences at that time as you're misusing it. In fact, you may actually feel like you're getting some benefit. But you're right. The problem is when later at some point, and large numbers of people are now getting infected with very common infections that are resistant to the available antibiotics. So as you mentioned earlier, urinary tract infections, respiratory tract infections, sexually transmitted infections, TB, all of these are bacterial diseases that need antibiotics that work. And what happens is if we get resistance, we need new drugs or new antibiotics to be able to treat them. Those are often more expensive, they're more dangerous, they have more side effects. And eventually, for some infections, we just completely run out of possible treatments because once you've tried one antibiotic and then you try a second or a third, and eventually some of the organisms that we have circulating at the moment for some common infections are resistant to many, many of the antibiotics. And so that is a significant problem. Basically, we have nothing left in the arsenal to treat those infections. And if you're unlucky enough to get one of those super resistant infections, then there are very few options to actually treat that case.
Duane, Blaauw, a pleasure to speak to you. Thank you so much for your time tonight.